when we're in the room for 3 to 4 hours at a time, it's because we're working to make sure that they're sedated. We're working to make sure that their paralytics are adequate enough, because the idea is to do what you can so you don't have to keep going back into the room. And what we've been finding with the patients with the COVID-19 is nothing's ever the same or similar. Some of these people require higher doses of medications that we're not used to. So we're finding ourselves having to stay in the room to adequately sedate them to make sure it's even safe enough to prone them or flip them over onto their belly. And a lot of the times their blood pressure, will drop pretty quickly. So we're staying in the room to make sure that it's at an acceptable measure before we walk out, because the idea is to stabilize them, do whatever you can before you walk out of that room, because we won't be able to run back in. So we've had a couple of donors provide us with lunches and dinners, which is so helpful because it's like one less thing that we have to think about. Because I know during this time we're so busy, it's hard to take care of ourselves or even find time to make a meal. So we've been really supported with some donors with food. Our doctors, also bring us some stuff, goodies, coffee. Coffee is so important to nurses, and it's just been like a never-ending supply of that too. So this has changed my routine in a way that I don't feel like doing anything on my day off. I'd rather just go home, chill out, have no noise, where normally I would plan for dinners or plan to see people or plan to go outside. I've actually preferred to just sit down, do nothing, kind of turn off some excess noise just to kind of calm my brain instead of have it stimulated again, I guess. Continue to be nice, continue to spread positivity. I know that, during this time, fear just makes your mind do and say things that you just don't mean. But I think it's really important to just continue to be nice because you never know what someone else is experiencing. You never know if they have a family member that's probably dying in the hospital because of this virus. And it's easy to try to find someone to blame it on, or a country to blame it on, or a specific community to blame it on. But it's nobody's fault, and we just have to continue to be nice and understand that we're going to get through this.